Hi and welcome to our telehealth video information series. My name is Garvin and this video is on Ciloxan Ear Drops. So what is Ciloxan Ear Drops used for? Ciloxan is used to treat certain types of ear infections caused by bacteria. The infections are usually middle ear infections. Ciloxan contains ciprofloxacin hydrochloride, an antibiotic that belongs to a group of medicines called the fluoroquinolones. This antibiotic works by killing the bacteria that are causing your infection. Ciloxan will not work against infections caused by viruses such as colds or the flu or infections caused by fungus. Do not use Ciloxan ear drops in children under 12 months of age. The safety and effectiveness of Ciloxan in this age group has not been established. And do not use Ciloxan ear drops if you have an allergy to ciprofloxacin or any other quinolone antibiotic. Also remember, do not use Ciloxan ear drops just before having a bath, shower or going swimming. If you do, you may reduce the effectiveness of this medicine. So using or taking other medicines with Ciloxan. Some medicines and ciprofloxacin may interfere with each other. So tell your doctor if you are taking any of the following: medicines to thin the blood such as warfarin, medicines to prevent tissue rejection such as cyclosporin, and theophylline for asthma, and caffeine for the treatment of migraines. So how do you use Ciloxan? The usual dose in adults and children is 5 drops of Ciloxan to the affected ear twice a day for 9 days. So follow the steps to use the ear drops. First, wash your hands thoroughly with soap and water. Shake the bottle. Then remove the cap from the bottle. Hold the bottle upside down in one hand between your thumb and middle finger. Tilt your head to one side so the affected ear is facing up. This may be easier in the sitting or lying down position. Place the dropper tip close to it, but not touching your ear, and gently tap to press the base of the bottle and with your forefinger to release drops. Hold the head in the same position for about 1 minute. This will help the drops to reach deeper into the ear. Repeat what I've just said, these steps, for the other ear if necessary. Place the cap back on the bottle and close it tightly. Wash your hands again with soap and water to remove any residue. There might be a slightly unpleasant feeling as the drops flow all the way into the ear. Be careful not to touch the dropper tip against your fingers or the ear or anything else. This will help prevent the ear drops becoming dirty or contaminated. So when do you use Ciloxan? Use Ciloxan at about the same time every day, unless your doctor tells you otherwise. Using your ear drops at the same time each day will have the best effect on your ear infection. It will also help you to remember when to use it. And how long do you use Ciloxan for? Continue using your medicine for as long as your doctor says. As Ciloxan ear drops start to kill the bacteria that are causing the infection in your ear, you will start to feel better. However, it is very important that you continue to use your Ciloxan ear drops for the full treatment period, so that to ensure that the infection does not return. If you forget to use the Ciloxan ear drops, if it is almost time for your next drop, skip the missed drop and use your next drops when they're meant to be taken. Otherwise, use the drop as soon as you remember and then go back to using them as you would normally. Do not use a double dose to make up for the earlier missed dose. Tell your doctor or pharmacist as soon as possible if you do not feel well while you're using Ciloxan. This medicine helps most people with middle ear infections, but it may have unwanted side effects in a few people. Tell your doctor or pharmacist if you notice any of the following and they worry you: bad taste in your mouth following the use of Ciloxan, ears stinging or discomfort following use of Ciloxan, a headache, ear pain, vertigo and transient dizziness, ear itching, and scaling of the outer ear and ear congestion and weeping of the ear. So there are more common, or these are the more common side effects of the medicine. They are usually mild and short-lived. If any of the following happen, stop using Ciloxan. Tell your doctor immediately. So a skin rash, swelling of the face, hands or feet, wheezing, difficulty breathing, severe and sudden onset of pinkish, itchy swellings in the skin called hives. These hypersensitivity reactions can be very serious side effects. You may need urgent medical attention or hospitalization. So these side effects are very rare. So next is storage. You keep Ciloxan ear drops in a cool, dry place where the temperature stays below 25 degrees. Do not refrigerate or freeze eardrops, as the cold eardrops may hurt your ears or cause temporary dizziness, and also protect the drops from light. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through our website, mytelehealth.info, or call into us at Lynch's Pharmacy in Douglas and Cork, or you can ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.